There are, I think, 6 basic science instructors, 6 full-time basic science instructors. And each one of us, we're not chiropractors. Some of them have MD degrees, all of us have PhD degrees. So we're highly trained in our respective fields. My fields are biochemistry, microbiology, and immunology. We have anatomists, we have physiologists, we have pathologists, pretty much everything covering what you might think of as basically medical type of sciences. Well, we're medically oriented here. If you haven't caught on to that, you might want to check out that first year of your instruction here, because you're going to get biochemistry, you're going to get physiology, pathology, anatomy, and sometimes people say, well, I want to be a chiropractor. I want to work on people's knees. I don't want to do all that stuff. Why do I need to learn microbiology? In fact, I've been here 11 years and actually needed a job when I moved down to Texas, and here it was. And I got to thinking, why does a chiropractic school need a microbiologist? Because that's what I'm trained as. I'm a clinical microbiologist. Did my PhD work at a medical school? Why would anybody? And because my idea of a chiropractor was just they adjust. But then once you get here and once you say, well, why do I need to do this? That's actually why. Because you're going to have people coming into your office wanting to know, why are you doing that? How is that going to help? Heaven help you if I come into your office. I'm going to ask you to run through the Krebs cycle. Or just what is the gram stain of E. coli? I mean, you never know. You never know what's coming in. And you need to be able to have that basic science education so you can answer those basic questions. My husband goes to Dr. Coates, who is a chiropractor on campus, and he had a problem with his foot. His foot was, his toes were pointing up. And I said, well, you need to have something done about that, because I don't want you to have your feet pointing up like that. Go see Dr. Coates. And when you go, ask him what he's going to do and why should you be doing all these exercises that he's going to prescribe for you. And it's simple, basic questions. And I knew I could do that. I knew I could set Jesse up because he would be able to answer why. And it's an important type of thing. You do nutritional consults?
Absolutely.
Okay, why should I buy vitamins from you?
That's right.
What are those vitamins going to do?
That's right.
Yeah, he needs to be able to answer that. What if you can't answer it? What is that patient going to do?
They won't trust you.
Yeah, first off, they're going to say, hey, they don't know that. Maybe they don't know anything. I don't want them touching me, and I'm going to tell all my friends. So it's word of mouth. That's how you got your business started. It's word of mouth. So you need to be just as highly trained as possible. You might think towards the end of your first trimester, I just want to get out. Just get me out of anatomy, get me out of biochemistry. If I see that biochemist one more time, it's a 6-hour course, for goodness sakes. But you have to understand you're going to be using all that. And you do need that basic science. So it's not something that we just waste your time with. We're science-oriented. You're going to need that. Not just to pass your board exams, but you're going to need it when you get out into practice.